caretaker can come into play. As long as the cuff is worn around your fingertip, this gives you a beat to beat, literally beat to beat blood pressure data, so nothing is lost, and um, that kind of rich resource will provide you with any event that will alert you or alarm you. In other words, uh, you know, and perhaps direct you to do take an action. If somebody's blood pressure uh, is trending down or dips down, or blood pressure goes up excessively, all these acute blood pressure changes can be detected in all good, you know, because it's non-invasive. Uh, you know, um, there are ways to continuously monitor your blood pressure invasively, but you know that those invasive techniques are usually reserved for certain patients. So, for example, they may be in the ICU, and they need to have this procedure done. Not to mention risk associated with these procedures and having these types of indwelling catheters in your body, in your arteries. Not most desirable. Of course, those techniques may be necessary at times, but I think caretaker gives you an additional information without requiring such an invasive mode of measurement. So yes, I think it has a tremendous implications in our in taking care of patients in the hospital setting, and I look forward to seeing it being more adopted more in clinical practice. I think people in the field come to realize the importance of blood pressure that uh, at nighttime that fluctuates significantly throughout the night. It may be related to perhaps sleep apnea. It may be related to other physiology, such as arousal, waking up, or body movement, or something that's unrelated to all this. But we all know that blood pressure fluctuates throughout the night, and we all know that high blood pressure at night, as a whole, is highly ominous sign and predictive of poor outcome, poor cardiovascular outcome, and even mortality. That concept is well established. When I'm speaking of sleep evaluation, sleep study, there is a zero component of blood pressure monitoring at present time. Whether you undergo sleep study in a sleep lab, or whether you undergo home sleep test, in whatever form, as of right now, there's no component of blood pressure monitoring embedded to it. So we don't even have that information about blood pressure to begin with. But as I just mentioned, the field has come to recognize the importance of blood pressure at nighttime in sleep because it's tightly linked to cardiovascular outcome. Caretaker is very unique in that it's something that you can wear at nighttime with minimal discomfort. And I actually have tried this in some of my patients. They've tolerated this very well. And the quality of the signal from the device has been very good and excellent. And very interesting that in some of these studies that I was involved, patients who wore this device afterwards first question they ask me is not about their sleep or their sleep apnea, but their first question is, what was my blood pressure like at nighttime? So that really struck me, that people understand the importance of blood pressure. And unfortunately, this is not something that we do right now. There are some other technologies and means of doing this, but to my knowledge, it has a lot of challenges with those technologies. So Caretaker has a great potential to be adopted to sleep as part of sleep evaluation. But even beyond sleep evaluation, it has a potential to be incorporated as one of the means to assess one's cardiovascular prognosis, just as a standalone measurement. And so now with this device, of course, we will have a luxury to see beat-to-beat blood pressure data, which is something that's probably we're not used to. So this will give us a fresh set of eyes where we will have to find out how to interpret this data. But I'm excited because at least it will give us, it gives us a dense amount of blood pressure data. And I'm personally working on how to better characterize these beat-to-beat blood pressure measurements so that we can generate something that's meaningfully communicated to clinicians and patients. So I'm very enthusiastic about the technology, and I think especially in the context of monitoring and cardiovascular prediction, I think this has a great promise.